Cancer screening ages. I give my recommendation for each one.
Colorectal cancer.
45 for average risk, earlier with symptoms or family history. Don't wait. For additional screening, ask for a CEA and CA19-9 blood tests. These are not diagnostic of colorectal cancer, but are often elevated when cancer is present. I think they're worth getting.
Breast cancer.
40 for annual mammograms, 30 with a positive BRCA status or a strong family history of breast cancer. However, monthly breast self-exams should start at age 21. You know your breasts better than anyone. For an extra layer of screening, ask for CA15-3 and CA27.29 tumor markers on blood work. These are not diagnostic, but elevated levels should prompt additional testing.
Cervical cancer.
21 for first pap smear. Add HPV co-testing around age 30.
Prostate cancer.
Official guideline is to start at age 50 if you are of average risk, and are 45 for African American men and those with a family history of prostate cancer. I recommend getting a baseline PSA blood test at age 30 or 40 just to be proactive.
Lung cancer.
50 with significant smoking history. Annual low-dose CT scan. Most people don't know this exists.
Skin cancer.
Annual full-body skin check starting in your early 30s is ideal. Earlier though, if you have a history of sunburns, fair or freckly skin, or a melanoma history in the family.
Ovarian cancer.
No standard screening for average risk individuals. I recommend getting a CA125 blood test starting at age 30 or 40 though. It's not diagnostic, but an elevated level can often be the first sign of ovarian cancer. Know the symptoms: bloating, pelvic pain, urinary changes. Advocate for yourself.
Pancreatic cancer.
There's no recommended routine screening. However, I recommend a CA19-9 blood test. Although it's not diagnostic, it's frequently elevated in pancreatic cancer. Why not check it just to make sure it's not elevated in the absence of symptoms? Since I'm all about being proactive as we can, I'm a big fan of the Gallery test. It's a blood test that screens for over 50 types of cancer. I believe it's worth getting one around age 40, but if you're concerned, you can get one sooner. It doesn't replace the aforementioned screening tests, but in addition to them, it can put you way ahead of the game compared to what most people are getting. And if your test is negative, it can give you a tremendous peace of mind.